Natural is the word of the day. You have to look like no one touched you.
Hi, I'm Ariel and I'm interested in getting an eye lift. I've been thinking about having an eye lift for about a year or two. Eyes are the window of the soul, and my soul is young and fun, and my eyes just aren't saying young and fun anymore. I just noticed that they're getting like saggier, and I've always had like super big bags under my eyes. Now with the aging, the circles, the bags, everything is just far worse.
My name is Dr. Barry Martin Weintraub. I am a board-certified plastic and reconstructive surgeon, as well as a real self-verified plastic surgeon. I specialize in detailed cosmetic surgery of the face, eyes, nose, and anything above the neck. Surgery around the eyelids has gained tremendous popularity in recent years, particularly among younger people, not only those who are aging. My practice really focuses on a natural appearance. I don't want to change the shape of someone's eye. The eyelid area, or orbitomalar complex, is composed of the brow, the upper eyelid, and the lower eyelid.
I am interested in both upper and lower. Like if we're gonna do it, let's do it. I have tried eye cream, skincare products. I've also gotten injectables under my eyes. And the injectables actually looked really good for a while until it started getting swollen. That wasn't a good look. That wasn't what I was looking for. The other thing that's really made it harder for me is having two very honest little girls at home. It's very, very common for mainly my oldest to say to me, "Mom, you look really old. Like, what's with your eyes?" That's why I'm looking at the eye lift surgery.
As we get older, we start to develop the normal gravitational descent of soft tissues around the eyes. That being upper eyelid skin, which is very thin, and lower eyelid skin, which is thin as well and often shows the puffs coming through. Sometimes a friend or a family member will say, "Mom, Dad, Grandpa, how come you look so old?" And they're not old at all. It's just that their eyelids are showing signs of early aging before even the face, jawline, jowls, and neck begin to show themselves. Classically, an ellipse of skin is removed from the upper eyelids. However, behind that skin are also two fat pads, a middle and medial fat pad. Those must be removed as well, leaving a clear, neat, very low incision so that no one can see the incision when someone blinks. The transconjunctival lower lid blepharoplasty is approached from the pink side of the eye, not from underneath the lashes. Fat can be teased out of the three fat pads on each side, creating a beautifully smooth lower eyelid. The skin is now handled with a laser, so we can smooth the wrinkles on the surface and take out the fat from behind.
I've done a fair bit of research. I'm kind of nerdy. So I'm gonna have a lot of questions. I wanna really understand what the risks are.
Surgery of this nature is not very invasive and usually takes about an hour and a half to 2 hours. All eyelid lift surgeries, or eyelid rejuvenation surgeries, are performed with a corneal guard on the eyeball. We want to always make safety number 1, safety number 2, and safety number 3.
I am concerned about the downtime, so I would want to make sure that I can get back to looking my girls in the eyes and my job. I need my eyes.
The surgery is performed, and often there's a little swelling or bruising afterwards, which usually is gone in about a week. Right after an eyelid lift or eyelid surgery, that clock is going to be pushed back a good 10 years. The eyes are going to look sharper, younger, and much more attractive.
I have read that you can get an eye lift surgery, but you might need one again in another couple of years. So I would really want to understand what I was looking at.
We continue to age. The process does not stop. The amount of sunlight you take, the amount of stress you incur, what your diet is like, and most important, your genetic predisposition, can cause eyelids to sag again. But there is a big upside. There's really not that much skin and fat around the eyes. So to have to undergo a second eyelid surgery would be rather rare, but possible in later years. If you want to look at what is optimal or ideal, patients from ages 20 to 30 on up present with a complaint of having had excess eyelid skin, often hanging onto the lashes, obscuring vision even in some cases. They make a patient look older and tireder than their stated age.
When you put it in the context of thinking that injectables could actually cost just about the same, if not more, it seems like a pretty good investment to me.
Sometimes patients ask, does eyelid surgery get covered by insurance? In truth, it really does not cover this procedure. If one had an excessive amount of upper eyelid skin, obscuring one's field of vision, along with documentation from a local ophthalmologist, an insurance carrier may, and I say may, consider that claim. But in general, this is aesthetic cosmetic surgery that has nothing to do with insurance coverage. I suppose there are some pros and cons to eyelid lift surgery. The pros are clear. Obviously, if one has excess skin and fat in the lower eyelids, or the brow position is a little low, in skilled hands, this is repaired in the operating room. The surgery takes really only about an hour or two. Pain is absolutely minimal. Patients are usually on extra strength Tylenol by the next day. Of course, there's a little bit of bruising and some swelling, but this dissipates very rapidly, and I would say a patient is camera ready by day 7 to 10. When one thinks of cons looking at patients from years ago, some surgeons have taken out too much fat around the eyes, such that the eye can look sunken and skeletonized. That is a technical surgical error which one would not want to make in this day and age. What else can happen? Hemorrhage is a problem that some people think about, but the way to combat bleeding in any surgery, including the eyelid area, is to move along slowly and cauterize those blood vessels as the surgery is going on. In unskilled hands, asymmetry can occur. That is not something one would want to see after a superior eyelid surgery. Is it worth it? According to Real Self, it is over 95% worth the time and money spent to rejuvenate one's face. I suppose there's always that residual 5% who are unhappy. Perhaps too much skin was removed, or their expectations are not realistic. In truth, eyelid rejuvenation surgery, when performed properly, should be an incredibly gratifying and successful surgery.
I think that the new Ariel post eye lift will be super, super fierce. I think that my oldest will be like, wow, Mom, you look awesome. Actually, that will never happen, but I hope the outside Ariel will look as young and energetic as the inside Ariel feels.
Have you had an eye lift? If so, please tell us about it. Be sure to subscribe to Real Self.